I would like to discuss with you the rotator cuff. The rotator cuff is made up of 4 different muscles. They support our upper arm bone, our humerus, fitting into the socket of your scapula, so your shoulder blade. Your shoulder blade comes around and it fits right in that socket. That humerus is a ball and socket joint. You have your top back muscle, which is the supraspinatus. You have your infraspinatus. You have your teres minor, and you have your subscapularis, which is on the inside front of your scapula. These muscles provide the support of holding the humerus, so that upper arm bone, into that socket. And they also help with outstretching the arm and with the rotation, internal and external rotation. Once we hit our 40s, the rotator cuff can become a problem for tearing. The tearing can occur as a partial tear, which is just some of the muscle fibers or some of the muscle tendon fibers end up tearing. Normally, with a little rest and recovery, that muscle or muscle tendon can repair up and heal over time. But you do have to give it time, because if we go back to the activity that may have caused it too quickly, then it can just wear away until it becomes a complete tear. So a complete tear is when it's actually severed or that tendon pulls away from the bone. So then that muscle does not have that action any longer. Tearing the rotator cuff can happen from a traumatic injury, from lifting something too heavy, from lifting something and jerking to lift something too heavy. If you are a pitcher or have any repetitive internal, external rotation in that shoulder for work, those are things that can aggravate and injure that rotator cuff. Over time, it becomes wear and tear, and it just degenerates the rotator cuff. Some sports that put a lot of pressure on that rotator cuff would be tennis, swimming because of the overhead activity, and baseball. These exercises have a lot of use up in those shoulders. So it's very important. These exercises in these sports are extremely great for our body. It keeps us active, and our bodies are meant to move, but we want to make sure that we have stability and we hold that ball and socket together, because when there's instability in movement, that's when we have the possibility of a tear. And we need to make sure, if we do have a small tear, that we take the time to rest it, recover it, and rehab it. Some prevention strategies would be avoid too much heavy lifting overhead. In addition to any repetitive motion that you are performing, make sure that you take frequent breaks in between. Also, you need to stretch the shoulder. A lot of times we become rounded, so stretching in that doorway promotes good flexibility up in that shoulder, and also maintains stability. So some exercises to keep that shoulder girdle nice and healthy, which is what I'm going to show you here in a little bit. Signs and symptoms of a rotator cuff tear or rotator cuff injury are, of course, first thing is pain. You would have just pain with activity and movement. You would also have pain if you kind of push on that shoulder underneath that clavicle. You would have pain possibly in the back along the shoulder blade. In addition to limited range of motion, sometimes you can only lift so far, or you have weakness. And a lot of times I will ask a patient to lift their arm up, and if their arm comes down, it's just a little test. So you want controlled range of motion coming down. A lot of times if there's a rotator cuff tear, they can't lift it up as high, and they also don't have the ability to bring it down nice and slow. And that lets me know that there's something going on in that rotator cuff. I also do a little test in that I give them some resistance for external rotation and for internal rotation. So taking our arm out is external, bringing it in is that internal rotation of the shoulder joint, and that helps to promote stability. But if someone's not able to hold that resistance, a lot of times it means that there's something going on in that rotator cuff. For some treatment, you might need to immobilize that shoulder for a little while, and you may need to have it in a sling. You also need to ice, and you can also elevate up above the heart. So if you're lying down on the couch, you can elevate that arm up above the heart to help with any swelling that might be down in that extremity. And also you can take the over-the-counter anti-inflammatories such as ibuprofen, Advil, and Aleve, whatever you like to take. If you do not get better, or if you have loss of control of that arm, it is best to see your physician, because the sooner that you get it taken care of, the better that they can take care of it. At times, if it's a small tear, physical therapy really can help in learning the exercises to stabilize that joint. Also with using some modalities that we have, some anti-inflammatories that we can apply to the outside of your shoulder, or we can do electrical stim to help with the pain. So normally the rotator cuff, fortunately, will heal up and you will not require surgery. Surgery is less likely, but if you have a complete tear, to have function up in that shoulder, it's very important. There's different techniques for surgeries, and at that point, you would need to follow your doctor's protocol. To get into some stretching activities, there are a couple that I really like for the rotator cuff. Depending too, if you have limited range of motion, sometimes using a wall to slide the arm up and help assist with your other arm, and we can lean our body into that stretch and come down. You can also do the same thing so that was shoulder flexion. You can also do the same thing for shoulder abduction. You can climb the wall and you can use your arm to help slide it up to gain that normal range of motion. But here we can do a doorway stretch. So we place our arms, elbows, and hands up on the wall of that door, and we lean into it. Stretching should be done 3 reps, holding for 30 to 60 seconds. Great stretch, helps promote good flexibility because we end up rounded over time. We really open that chest up and support our shoulder function. Another way to perform this stretch is if you have a rod or if you have a body bar, you can place it up and over, resting it on the back of those shoulders. Hands nice and comfortably pressing front. You roll the shoulders down and back, and you pull the elbows forward. This is also a great stretch. But again, we want to make sure that we're on the rehab end. So anything that really puts any pull or any pressure, causing any increased pain, that's not something that you're ready for yet. So another exercise to be performed for strengthening the rotator cuff would be a scapular retraction or a row, in which you're just going to pull the elbows back and release. Pull the elbows back and release. Using our resistance band, and we're going to build to 30 repetitions. Another strengthening exercise for the rotator cuff would be a reverse shoulder fly. So we bend our knees, we bend over slightly, we kind of hug around, and we bring those elbows up and out, up and out. We never pull back, but we bring those elbows nice and tall, up and out, just like this. Again, building to 30 repetitions, and you want to start out with low enough weight. This is 3 pounds here. You start out low. Sometimes you start out without any weight at all, and we progress and we advance using those weights. My favorite exercise for the rotator cuff is internal and external rotation. So I'm going to use my little ball here as my pillow. I'm going to lay down, and I'm going to keep my elbow tucked into my rib cage. Again, I have my 3-pound weight. My weight is resting on the belly, elbow tucked in, and I'm going to do external rotation. Lift and lower. Making sure not to move the shoulder back. That is one of the most important things for that external rotation. Then we can switch to the other hand. You're going to tuck that elbow under so it's tucked into that rib cage. Rest the upper arm, and you're going to bring it up and lower. Bring it up and lower. And this is performing the internal rotation. And of course, we need to switch sides so that we get both directions for each side. Even if you have a rotator cuff on one side, you should always strengthen your opposite. So having one side stronger than the other one is definitely a problem. I've seen in some of my aerobics classes someone use 5 pounds on one side and 10 pounds on the other side, and they're lifting. If you're lifting this way, your 5-pound side is going to remain weaker than our 10-pound side. And not only that, but if we're doing lunges and different things, this is also affecting our legs, and it's affecting our core. And our core is our most important at stabilizing, then our ball and sockets, and then our extremities. So very important to keep each side at the same weight and to strengthen both sides. Hopefully this has been a beneficial discussion for you. Have a great day. I'll see you soon.